Hey there, just want to give everybody an update. I've left the hospital. I was in the hospital for 16 days. When I was in the hospital, they started a bunch of antibiotics for the severe spinal infection that I had. And what you can see here, I get an IV 3 to 4 times a day that will run for 2 to 3 hours a day. And that's vancomycin is what it is. And it's so strong, they have to draw my blood every other day to check the levels because they say it can blow out my kidneys. So they have to adjust the dosage and the time for that. They also have me on a pill form of antibiotics as well. Like I said before, they cut me from C5 to T5. So I have a cut 18 to 20 inches starting at the base of my skull going all the way down. Last week I was moved to Encompass Rehabilitation, and it's a smaller facility. The only thing I have to compare it to is the Shepherd Center, and that was 25 years ago, but it's very small. They're not as I guess they don't have the technology, it seems like, or the intuitiveness that Shepherd does. Sometimes they just want to like play games or something, like literally like try to play a game with your hand, and I tell them that I'm not interested in that. I'd rather use the E-stem to try to wake up my fingers, or the massager to try to wake up the nerves or something like that. But as you can see, my left hand has it's getting better, so I can touch my fingers like that, but it's just very weak. But a week and a half ago, I couldn't pick up a cup. So that's a full cup. I'm able to do that, thank God. And just yesterday, I was able to start twitching my thumb. So it's exhausted right now because I've had 3 hours of therapy. But my thumb, and also, if you look right here, these knuckles, you can kind of start to see them flex in some there. But and I was able to, before I could just do like that, lift my wrist up, and now I can do it the other way as well. So there we go, you can see the thumb a little bit there. So it's kind of starting to wake up. These two fingers are on a different nerve, and they're still pretty numb. But when they were hooking the E-stem machine up to me today, which is the electronic stimulation, this one was moving some, and the pinky very slightly. So I truly believe with time we're going to get more back on that. I'm going to be on these antibiotics until the end of the month. So total it's like 6 or 7 weeks, something like that. But I've been up and walking. They've had me on a platform walker. I've had a lot of people ask me about my legs, how they are now versus before the procedure. And I think I still have the same muscles, they're just weaker. So, and then today they took one side of the platform off because this arm has gotten better. And so I'm just holding on to the walker instead of using the forearm. And like this arm, I mean, I can pick it up and move it, and so I have muscles there. We just have to work on getting them stronger, and waking up these fingers here and these hand, the hand and the fingers. But we are seeing progress. It's just a long, slow road, and had the physical therapists and stuff they've kind of been confused because this is my second spinal cord injury. And so they asked me if this has something to do with my first spinal cord injury. And I say no. I said, I had an emergency surgery February the 14th. On February the 14th, my hands worked fine. I mean, these two fingers and my thumb on both sides were starting to kind of lose strength, but I mean, I had all my dexterity and everything. And it was after the surgery that I lost this. And the surgeons say that because the infection was so bad, they had to go in there and manually clean out the infection, and you know, it wasn't just liquid anymore. A lot of it was gel-like, and then they had to manually decompress my spine from where the abscess was pushed on it. So this is just a result of having to go in there and manually just clean things out. That's what this is from. So, but I'll keep you updated. I just want to let you know what's going on. I just finished up therapy, and I'm going to rest a little bit. So we'll talk to you soon.